1. Cardiac medications, ACE inhibitors, lisinopril and enalapril. ACE inhibitors lower blood pressure by blocking the renin-angiotensin system. The big red flag? A dry, nagging cough, because bradykinin builds up. The serious one is angioedema, swelling of the lips, tongue, or throat. That's a call 911 emergency. They also raise potassium, so always monitor potassium levels. Teach patients not to stop abruptly and to report swelling immediately. ARBs, losartan, valsartan. Cousins of ACE inhibitors. Same blood pressure lowering effect, but without the cough. Still can raise potassium, still can cause angioedema. We monitor blood pressure and potassium, just like ACEs. Beta blockers, metoprolol, propranolol, these block adrenaline. That slows the heart and lowers blood pressure. Check the heart rate before giving. Rule, hold if under 60 beats per minute. Propranolol especially can trigger bronchospasm, so be cautious in asthma or COPD. Never stop these suddenly because the heart can rebound with dangerous rhythms. Calcium channel blockers, amlodipine, diltiazem, verapamil. These relax blood vessels, so blood pressure drops. Side effects, swelling in the legs, dizziness, constipation. Teach patients to avoid grapefruit juice because it interferes with metabolism and can send drug levels sky high. Digoxin, strengthens heart contractions but slows the rate. Therapeutic level is 0.5 to 2. Toxicity looks like halos around lights, nausea, or irregular rhythms. Always check the apical pulse for 1 full minute. Hold if under 60 in adults or under 90 in infants. The antidote is digoxin immune fab. Nitrates. Nitroglycerin. Nitro opens vessels fast. Sit down before taking because blood pressure can drop suddenly. Headaches and flushing are common. Here's the golden rule. Take 1 tablet under the tongue. Wait 5 minutes. If chest pain isn't relieved, call 911 right away. While waiting for help, a second and even a third dose can be taken, 5 minutes apart. But if 1 tablet doesn't work, this is a heart attack until proven otherwise. Statins, atorvastatin, simvastatin. These lower cholesterol. Watch for rhabdomyolysis, muscle pain and weakness, and liver toxicity. Monitor liver enzymes. Teach patients to take at night, because that's when the liver makes cholesterol. Antiplatelets, aspirin, clopidogrel. These make platelets slippery to prevent clots. The risk is bleeding. Teach patients to report black stools, avoid NSAIDs, and be careful with razors and toothbrushes. Anticoagulants, warfarin, heparin. Warfarin is monitored with INR, goal 2 to 3. Antidote is vitamin K. Heparin is monitored with PTT. Antidote is protamine sulfate. Teach patients to keep vitamin K intake consistent, no sudden kale diets, and use bleeding precautions. Thrombolytics, alteplase, TPA. These dissolve clots. They save lives but carry very high bleeding risk. Contraindicated after surgery, trauma, or hemorrhagic stroke. Always monitor for neurological changes because the biggest risk is intracranial bleeding. Number 2, respiratory medications. Albuterol, rescue inhaler. Works fast, opens up the lungs. Side effects are tremors and a racing heart. Always teach this is for acute attacks, not daily prevention. Salmeterol, long-acting inhaler. Prevents attacks, but never for rescue. That's a testable point. Theophylline, therapeutic range 10 to 20. Above that, seizures and arrhythmias can happen, so we always monitor levels closely. Ipratropium, an anticholinergic bronchodilator. Side effect, dry mouth. Teach patients to sip fluids, suck on sugar-free candy. Inhaled corticosteroids, fluticasone, budesonide. These reduce inflammation in asthma. Risk, oral thrush. Always teach patients to rinse their mouth after each use. Montelukast, daily medication to prevent asthma attacks, not for rescue use. Oxygen therapy. In COPD, too much oxygen can reduce their drive to breathe, so we keep it low, usually no more than 2 liters, and monitor closely. Number 3, neurologic medications, phenytoin, seizure med, therapeutic range 10 to 20. Side effect, gingival hyperplasia. Teach meticulous oral care. Never stop suddenly, or seizures can rebound. Carbamazepine, risk agranulocytosis. That means dangerously low white cells, so infection risk goes way up. That's why we monitor the CBC. Valproic acid, can damage the liver. Monitor liver function tests. Levetiracetam, a favorite for seizures because it has fewer interactions. Still, monitor mood changes. Benzodiazepines, lorazepam, diazepam. These calm the brain quickly. Side effects, sedation dependence. Antidote is flumazenil, used for acute seizures or severe anxiety. Barbiturates, phenobarbital, strong CNS depressants. Rare now, but you need to know. Respiratory depression and dependence are risks. Parkinson's meds, levodopa-carbidopa, boosts dopamine. Side effects, involuntary movements, and harmless but odd dark urine. Teach avoid high-protein meals because protein interferes with absorption. Alzheimer's meds, donepezil, improves memory slightly, but not a cure. Side effects, GI upset, bradycardia, so monitor heart rate. Number 4, endocrine medications, insulin. Know the types, rapid, short, intermediate, long. Rule clear before cloudy when mixing. Watch for hypoglycemia, shaky, sweaty, confused. Always double-check doses. Metformin, first-line diabetes drug, can cause lactic acidosis, especially with contrast dye. That's why we hold it 48 hours before and after contrast. Sulfonylureas, glyburide, glipizide, stimulate insulin release. Risk, hypoglycemia. Levothyroxine, for hypothyroidism. Take in the morning, empty stomach. It's lifelong therapy. Teach patients, don't skip, don't stop. PTU and methimazole for hyperthyroidism. Risk, agranulocytosis. So again, monitor CBC. Corticosteroids, prednisone, powerful anti-inflammatories. Side effects, high blood sugar, infection risk, fragile skin. Never stop abruptly, always taper. Desmopressin mimics ADH. Risk, water intoxication and low sodium. Monitor intake, output, and sodium. Growth hormone, given subcutaneously to children. Monitor growth and bone development. Number 5, GI medications. Antacids, take 1 to 3 hours after meals. Don't take with other meds because they interfere with absorption. H2 blockers, ranitidine, famotidine, reduce stomach acid, safer, fewer side effects. PPIs, omeprazole, pantoprazole, also reduce acid, but long-term use raises risk of osteoporosis. Teach, take before meals. Sucralfate, coats ulcers to protect them. Give before meals, but not with other meds, or it blocks absorption. Ondansetron stops nausea. Watch for QT prolongation on the monitor. Metoclopramide speeds up gastric emptying. Risk, tardive dyskinesia, those involuntary movements. Laxatives, Senna, Bisacodil, great for short-term constipation, but risk dependence if used too long. Lactulose, used in liver disease to lower ammonia. Monitor stools and electrolytes. Pancreatic enzymes, pancrelipase, for cystic fibrosis, must be taken with meals to help digest fats. Number 6, pain and inflammation NSAIDs, ibuprofen, naproxen, can damage the stomach and kidneys. Always take with food. Avoid in ulcers. Acetaminophen, maximum 4 grams per day, too much damages the liver. Antidote is N-acetylcysteine. Opioids, morphine, fentanyl, hydromorphone. Powerful pain relief but slow the breathing. Hold if respiration's under 12. Antidote is naloxone. PCA pumps, patient-controlled analgesia. Only the patient should press the button. Always monitor sedation and respirations. Aspirin, risk of Reye's syndrome in children. Toxicity sign, ringing in the ears. Corticosteroids, same teaching as before. Taper, monitor blood sugar and infection risk. Number 7, psych medications. SSRIs, fluoxetine, sertraline, takes 4 to 6 weeks to work. Risk, serotonin syndrome, agitation, sweating, tremors, fever. SNRIs, venlafaxine, duloxetine, also used for nerve pain. TCAs, amitriptyline sedating, can cause arrhythmias. Overdose is lethal. MAOIs, phenelzine, danger, hypertensive crisis with tyramine foods like cheese, wine, or cured meats. Lithium, therapeutic range 0.6 to 1.2. Toxicity looks like tremors, diarrhea, confusion. Teach, increase fluids, avoid NSAIDs. Clozapine, risk, agranulocytosis. Monitor WBC weekly. Report fevers or sore throat right away. Haloperidol can cause EPS, tremors, stiffness, and NMS, which is life-threatening. Treat EPS with benztropine. Benzodiazepines, used short-term for anxiety or to prevent withdrawal seizures. Buspirone, non-sedating, safe for long-term use. Negar-8, OB and maternity oxytocin, stimulates contractions. Monitor for uterine tachysystole, too many contractions. If late decelerations show on the monitor, stop it right away. Magnesium sulfate, used in preeclampsia. Monitor reflexes, urine output, and respiratory rate. Antidote is calcium gluconate. Terbutaline, tocolytic, stops contractions. Side effect, maternal tachycardia and tremors. Betamethasone, steroid given to mom to mature baby's lungs. Watch for increased blood sugar in mom. Rogam, prevents Rh isoimmunization, given to Rh-negative moms. Methergine, contracts the uterus to stop bleeding, contraindicated in high blood pressure. Hemabate, also contracts the uterus, contraindicated in asthma. Misoprostol, used to ripen the cervix or stop bleeding, can cause cramping and diarrhea. Number 9, anti-infectives. Penicillins and cephalosporins. Check for allergies because cross-allergy risk is high. Macrolides, azithromycin, erythromycin. Watch for QT prolongation. Tetracyclines, doxycycline. Do not give with milk or antacids. Not for kids under 8, causes tooth discoloration. Photosensitivity risk, so sunscreen is a must. Aminoglycosides, gentamicin. Risk, ear and kidney toxicity. Monitor drug levels, BUN, creatinine, and hearing. Fluoroquinolones, ciprofloxacin. Risk, Achilles tendon rupture. Teach patients to report calf pain. Vancomycin, infuse slowly to avoid red man syndrome. Monitor drug levels and kidney function. TB meds, isoniazid liver toxic, causes neuropathy, give vitamin B6. Rifampin turns body fluids orange. Harmless, but warn the patient. Ethambutol causes eye problems, need regular eye exams. Antifungals, amphotericin B, very nephrotoxic. Monitor kidneys closely. Antivirals, acyclovir, hydrate well because it can damage the kidneys. HIV meds, always lifelong. Strict adherence is non-negotiable. Number 10, oncology and immune chemo drugs. Bone marrow suppression is the big one. That means neutropenic precautions. Methotrexate, liver toxic and very dangerous in pregnancy. Cisplatin, kidney and ear toxicity. Monitor labs and hearing. Monoclonal antibodies, rituximab, risk of severe infusion reactions. Epoetin alpha, stimulates red blood cells. Monitor hemoglobin and blood pressure. Filgrastim, stimulates white cells. Monitor CBC. Cyclosporine, used for transplants, nephrotoxic, always monitor drug levels. Number 11, emergency and antidotes. Naloxone, opioid antidote. Flumazenol, benzodiazepine antidote. Vitamin K, warfarin antidote. Protamine sulfate, heparin antidote. Calcium gluconate, magnesium antidote. Glucagon, for hypoglycemia if the patient can't take food. Digoxin immune fab, antidote for digoxin toxicity. Sodium bicarb, for tricyclic overdose or metabolic acidosis. Activated charcoal, absorbs many drugs if given early. Number 12, miscellaneous high-yield vaccines. Live vaccines, like MMR or varicella, are contraindicated in pregnancy and the immunocompromised. Iron supplements, best absorbed with vitamin C, like orange juice. Do not take with milk. Potassium chloride, never ever give IV push. Always dilute and give slowly. TPN, total parenteral nutrition. Monitor blood sugar, change tubing every 24 hours. Loop diuretics, furosemide, risk, low potassium and ear toxicity. Monitor labs and hearing. Spironolactone, potassium sparing. Avoid high potassium foods. Mannitol, osmotic diuretic, used for increased intracranial pressure. Monitor kidneys. Antihistamines, diphenhydramines, sedating, can cause urinary retention, especially in older adults. Herbal interactions. St. John's wort can cause serotonin syndrome if mixed with SSRIs. Ginkgo increases bleeding risk with warfarin. Kava and valerian cause sedation and liver damage. Closing. And there you have it, 100 high-yield medications for NCLEX. Don't just memorize side effects. Always ask, why am I monitoring this lab? What's the worst-case scenario I'm trying to prevent? That's how you move from being a student to thinking like a nurse.